So on an average, your salary for dentist 180,000. Once you get the full registration, I'm talking at least you have 2 3 year experience. So it's getting around 1 CR Indian rupees per year. So if you are a student, so you can come, basically you pass this ADC part 1 in your home country easily, and then you can come on a study visa here to do any course, for example, Master of Public Health or Hospital Management. Here is the everything taken care by the government. So if anything happened to you or your family members, you just need to go to any hospital, either free treatment, okay? Any GP clinic, any hospital, everything is free in Australia. This is the first thing.
Sir, someone is asking regarding the total expense one has to bear, right from the preparation till they start earning in Australia.
Hello everyone. So today we are going to talk about the dentistry. So if you are one of the dentists looking to migrate to Australia, so you might have a lot of questions regarding, to migration, exam or visa or jobs, all those things today we are going to cover. But if you have any questions related to dentistry, please comment below. So we'll try to take some of the questions as well. And Dr. Hillary will ask some of the questions to me, so then I will try to address in those questions. Yeah, over to you. Yeah, thank you.
So, sir, I would just like to take a few moments to introduce you to everyone.
Yeah.
Okay, because my audience might not be knowing you. So, right. So, hello, Dr. Akram. Welcome to our channel. So, academically.com is the brainchild of Dr. Akram Ahmed, and he has done his PhD from the Faculty of Medicine and Health, the University of Sydney, Australia. He is a self-motivated clinical pharmacist and committed lecturer with over 10 plus years of experience, and he has experience in teaching as well as research as well as in various subjects of medicine at leading universities in Australia, Malaysia and India. Thank you so much, sir, for taking out time and sharing this very much, important information regarding how one can, practice dentistry in Australia.
Yes. Thank you so much, Dr. Hillary. Yes, guys. So, hi. Today we are going to cover A to Z questions basically related to the dentistry, how you can migrate to Australia, how you can set up your practice in Australia. Yeah.
So, sir, we'll start with ADC because ADC is the first step for anyone who is, planning to practice dentistry in
Okay,
Australia. So, ADC is.
Yeah, I can just remind in 1 minute. So what are the steps you need to take in order to migrate to Australia? Okay. So first of all, the eligibility, any dentist have minimum 4-year bachelor degree, means BDS if you did from your home country, and you must be a registered dentist in your home country. Now you are eligible to apply for Australia. Okay. So there is some steps you need to complete in order to migrate to Australia. The first step is we call a document verification by Australian Dental Council. We will help you to complete this process, our documentation, and you can also do yourself, is up to you. The next step, you need to pass ADC Part 1 exam. This is called Australian Dental Council MCQ based question they will ask, so you need to pass this exam. And this exam you can give in your home country, whether you are in India or any other country, you can write this exam from your home country. And the next step, you need to pass English test, that is IELTS, OET or PTE. And then you need to pass ADC Part 2. This is a clinical exam or practical exam. What we can say is called OSCE exam. And this exam, you need to be in Australia to give this exam. And then you will get the general registration, and then you can practice dentistry in Australia. Or if you want to do PG in Australia, then you can do after you get registration in Australia. Then in any clinical branch, in general, there is like clinical or non-clinical branches. Non-clinical branch, no need to have registration. Without registration, you can do, for example, you want to do Master of Public Health or Master of Public Health Dentistry, right? So in that case, you can do, no need to get registration. But if you want to do any clinical branch, in that case, you need to get first registration, then you need to apply any PG in Australia.
Right.
I hope आपको बात समझ में आ गया होगा. Yeah.
Yes, yes, yes. Steps are very much clear, sir. But जो students को usual doubt रहता है वो ये है कि ADC एग्जाम कितना डिफिकल्ट है. क्या ADC पार्ट 1 हम फर्स्ट अटेम्प्ट में क्लियर कर सकते हैं? And how difficult is ADC part 2 compared to part 1?
So basically, ADC exam, if I compare with NEET PG इंडिया में, बिकॉज वही एक स्टैंडर्ड एग्जाम है जिससे हम कंपेयर कर सकते हैं ना. और तो उसके कंपेरिजन में मैं कहूँगा एडीसी इतना टफ नहीं है पार्ट 1. और पार्ट 1 का जो पासिंग रेट है वो है अप टू 60%. मतलब जो 60% तो बच्चे पास कर जाते हैं इन फर्स्ट अटेम्प्ट में. तो 50-60% बच्चे पास करते हैं. तो इतना टफ एग्जाम नहीं है पार्ट 1, है ना. और बहुत सारे बच्चे 2 महीने में इसको पास कर जाते हैं. हम लोग बेसिकली वी प्रोवाइड कोचिंग फॉर 3 मंथ फॉर एडीसी. तो दिस इज लाइक यू, अगर आप 3 महीने अच्छे से पढ़ लेते हो 4-5 घंटे पर डे का, यू कैन क्लियर दिस एग्जाम. इतना टफ एग्जाम नहीं होता है. तो अगर लगा लो अगर 100 बच्चे बैठ रहे हैं तो वहाँ पे 50 या 60 बच्चे पास कर रहे हैं. और बहुत सारे जो भी डेंटिस्ट हैं ऑस्ट्रेलिया में, आई कैन से यू नो एटलीस्ट 1/4 जो डेंटिस्ट हैं वो इंडियन ही है यहाँ पर ऑस्ट्रेलिया में. मेरा ऑब्जर्वेशन है कि मैं सिडनी में रहता हूँ, जब भी हम कहीं भी जाते हैं तो बहुत सारे जो इंडियन डेंटिस्ट यहाँ पर, इंडियन या जो है ओवरसीज क्वालिफाइड, यू नो, जहाँ से उन्होंने दूसरी जगह से डिग्री लिया हुआ है. अब बात आती है कि भाई पार्ट 2 कितना डिफिकल्ट है. पार्ट 2 में पूछते क्या है, क्यों, मतलब ऐसा लगता है लोगों को ना. तो पार्ट 2 में क्या होता है, एक ऑस्की एग्जाम होता है, ठीक है. तो हमारे इंडिया में वो ऑस्की एग्जाम नहीं होता है, तो इसलिए बच्चों को लगता है बहुत ज्यादा टफ एग्जाम है ये, है ना. और इसका जो पासिंग रेट है वो है करीब 25-30% तक. स्टिल एक 3 डॉक्टर्स जिन्होंने पास किया था एडीसी 1, वो फर्स्ट टाइम में जो है पार्ट 2 भी क्लियर कर रहे हैं ना. और कुछ डॉक्टर सेकंड अटेम्प्ट में करते हैं ना. तो ऐसे जर्नी रहता है एडीसी 2 का. तो 30% तक एडीसी 2 पास करते हैं बच्चे और 60% करते हैं एडीसी पार्ट 1. एंड ये जो पार्ट 1 एंड पार्ट 2 को जो आपको पास करना है, आपके पास में 3 इयर्स होते हैं. तो 3 इयर्स में यू नीड टू पास. ऐसा नहीं कि आपने एक बार फेल कर गए और यू नो देन यू नीड टू गो फॉर अगेन फ्रॉम स्टेप 1. आपको ये पार्ट 2 ही देना है नेक्स्ट टाइम थर्ड टाइम. तो आपके पास 6 अटेम्प्ट होते हैं इन जनरल आपको पास करने के लिए इन क्लिनिकल में पूरे 3 साल में. अगर आप 3 साल में नहीं कर पाते हो देन ही आपको रिवाइज करना है ना. तो आप डेफिनेटली, आपने अगर इंडिया से डेंटिस्ट्री किया है तो आप वो 6 अटेम्प्ट में नहीं, सेकंड अटेम्प्ट में तो आप डेफिनेटली कर जाओगे. पर फर्स्ट अटेम्प्ट में बहुत सारे डेंटिस्ट जो है पास करते हैं इस एग्जाम के लिए.
Right. Sir, few of the viewers are asking about, like they'll prefer we speaking in English. So I'll just translate it what just sir explained. Okay. So for the ADC part 1, passing rate is 60 to 70%. Okay. So out of 100 students, 60 to 70 students easily clear part 1, and you'll require 2 to 3 months of preparation. Right, sir? And
yes.
For part 2, it is difficult than part 1, but you'll get 6 attempts to clear your part 2. And passing rate for the same is 30 to 40%.
Yeah.
Because it is clinical based, and our healthcare standards are different than Australia's healthcare standards, and that's why it is a bit difficult. But if you are clearing your ADC part 1 in first attempt, then there are very much good chances that you'll clear part 2 as well in your first or your initial attempts only.
Yes.
Okay. So that was about the exam and everything. Now let's talk about, the pay scale and job opportunities. So how difficult or easy it is for someone to find a job in Australia as a dentist?
Yeah. So in Australia, dentistry is very, very expensive. Basically, salary is very, very high for dentists. So on an average, your salary for dentist 180,000. Once you get the full registration, I'm talking at least you have 2-3 year experience. So is getting around 1 CR Indian rupees per year. Okay. Even we can say lowest how much you are going to get. At least you will get minimum, I can say 6 to 7 lakh per month. At least you will get even when you are starting your journey. And getting a job, I can say if you are willing to work in regional areas. Regional area means like in India we have 4 metro cities like Delhi, Mumbai, and Kolkata, But apart from these cities, there's so many other cities like Lucknow also a city is there, Patna also one of the cities there, And so each state there is so small cities is there in India. So same like in Australia. So there are 3 cities, main cities: Sydney, Melbourne, and the Brisbane. So apart from these three cities, there is so many other cities like Perth is there, Gold Coast is there, right? So if you are willing to work in these areas, the opportunity is there, and government basically every year they make a list. They will give the PR visa or permanent visa or citizenship for them. If there is no demand, they immediately they remove that occupation. Okay, so a dentist, one of the it is in the list. It means there is a demand for dentists. That's why they are giving the PR visa and citizenship for them. That they're calling them. So jobs are there. A lot of jobs in the regional areas for the dentist. Even you can go seek.com.au. This is the #1 job website in Australia. You know, so just go and see. Just type dentist.
Right.
You will see how many jobs are available. So jobs are available a lot. Dentists in need Australia.
So, sir, after clearing ADC, Indian dentists practice as associate dentist in some other clinic, or they can start their individual practice, or they may get jobs in hospitals and all.
Yeah, I mean, initially they have to work under some supervision. They need some practice, basically, So at least I can say you need to learn the system here in Australia, all those things. So at least I can say they cannot open directly their own clinic. I do not recommend, very much, but at least work 2 to 3 years. Then you can open your own clinic if you want, So initially you need to work in some clinic or some dental hospital, and then you can go.
Right, right. And sir, one question regarding initial assessment, like how long it takes for approval of the
Yeah.
documents and
So
for the
they are
initial
saying,
assessment fees.
yeah. So assessment take maximum 8 weeks. But in general, if your degree and your everything you have ready, and there is no problem with your name also, okay, then hardly it take 3 to 4 weeks to complete the process.
Okay, 3 to 4 weeks. That's it.
Yeah,
And one can do it by themselves, or a support from an organization or academy is needed for that.
Yeah. So we basically provide assistance for documentation. So you just need to provide us your document, scan copy of document like your degree, your transcript, your passport, all those documents you just provide us, and we will take care of all this. Your documentation, skill assessment, first step, and then exam booking. We will assist you apart from the coaching.
Right.
And after even coaching, also this exam they conduct yearly 2 times, March in September. So every year, 2 times they conduct this ADC exam. Okay,
Right.
and I want to say one important thing is here. So if you are a student, so you can come. Basically, you pass this ADC part 1 in your home country easily, and then you can come on a study visa here to do any course. For example, Master of Public Health or Hospital Management. Then what you can do simultaneously, you can work here as an assistant dentist, one of the supervision of a dentist here in Australia, and you will get the hands-on practice. So very easy for you to pass ADC part 2. It is difficult if you are in India based on your Indian practice. You can pass directly this exam. So that's why it's a little bit tough for this part 2. But if you are practicing, if you are working in Australia, it's very easy. Make your journey. You can do these things.
Right, right. Now, sir, I have a few questions regarding visa process, like how difficult it is to get a visa after clearing all these exams and getting our, license to practice in practice dentistry in Australia.
So once you basically pass ADC part 2, so there are so many agencies here. They are hiring. They are ready to basically sponsor the visa, work visa, or you also eligible to apply your own permanent visa, PR visa. No need to and get a job and come to Australia and find a job. So both possibilities is there. You can apply work visa after ADC part 2, or also possibility to apply the work visa as well once you find a job.
Okay. And work visa is like permissible for how long? Like
Yeah.
for how
So
long it
work
is
visa
valid?
generally they will give for 3 years. Okay.
Okay.
Even if you are coming on work visa, directly you apply your PR visa, permanent visa. The permanent visa they will give you for 5 years. Okay. And after 3 years, you are eligible to apply Australian passport, Australian citizenship,
Right.
or you can renew this every 5 years. This PR visa. For example, I'm on PR visa. I'm Indian citizen still. Okay. So it is up to you. What you want. If you want to be on PR, or if you want to get Australian citizenship after 3 years, you can. वीजा मिलेगा 5 year का, but 3 साल आप यहाँ पर आपने जॉब कर लिया, आप रह लिया ऑस्ट्रेलिया में, then you can apply and that citizenship. But if you do not want to take citizenship, then you can renew another for 5 years. So every 5 years you can renew, as many times you want this PR visa.
Right. And what are the other benefits which are associated with, you're living in Australia? So
Yes,
I've heard that there are a few benefits regarding healthcare, like, and also regarding your, education and everything. So please highlight that also.
Yes. So this is a very common question. Students ask, what is the benefit to migrate to Australia, and they compare with some other countries like maybe UK or Canada or US,
Right.
So Australia provides the universal health coverage. So you no need to buy any insurance for you or yourself or your family as well. So here is the everything taken care by the government. So if anything happened to you or your family members, you just need to go to any hospital. It's a free treatment. Okay. Any GP clinic, any hospital, everything is free in Australia. This is the first thing. Secondly, if you have kids, so kids education is free in Australia. You no need to pay anything. Okay. So and apart salary is very high, and here the weather is very very nice. So this is like a moderate, not very hot, not very cold. So it got like up to around 8 to 10 degree, minimum. Maximum it go to around 35 around. So this is weather is very nice in Australia, and from many cities directly you can go to India and direct flight like Delhi, Mumbai, and Bangalore, Hyderabad. So there's a and right now very good relationship with Indian government and Australian government. This is also the advantage. That's why they give the preference for Indians to migrate to Australia.
Right. So on and all, it is a very good choice for those who want to, practice dentistry abroad. Out of all the options you have, definitely Australia is one of the best option we can say. And sir, someone is asking regarding the total expense one has to bear, right from the preparation till they start earning in Australia.
So total cost basically, is going to be around 7 to 8 lakh, total.
Okay.
You are paying around 80% basically directly the fees, like skill assessment fees, then ADC exam fees, then your English, exam fees, then ADC Part 2 exam, then visa fees. So it's going to be maximum 10 lakh, but it's a minimum 7 lakh you need.
Okay. And is it inclusive of coaching fees or coaching fees are extra?
Everything.
Okay, everything is included, and you should have 8 to 10 lakhs in mind. Like and then you
want to announce one important thing here. So at Academically, both the students basically they ask me, sir, how the question they ask in ADC exam. So we have a free mock test for you. Just go to our website. Okay. So there's one scholarship test is there. Go to that test, just fill your form, your name, phone number, and just click on ADC exam. Then there will be a same exam as like you are given in the ADC. Okay. Then at least you will know that what kind of question they are going to ask. You can practice basically. तो आपको पहले से practice हो जाएगा कैसे question आते हैं ADC में before you start your process.
Right. That is wonderful, sir. So I just would like to conclude this session and what all we discussed in this session. So we started with ADC exam, like it is conducted twice in a year in the month of March and September. Right, sir? And then we also discussed about the difficulty levels of ADC part 1 and 2 and compared that with our NEET MDS, which is here in India. Okay. Then we covered about the visa process. We covered and talked about the career and opportunities in Australia after clearing your ADC exam. And lastly, about the expense also. And also about the beautiful weather of Australia and the wonderful opportunities which Australian government is offering to us as a healthcare professional. So all in all, I think we have touched all the points. I don't think so we are missing anything. Right, sir? Do you want to add
I
anything?
mean, I think mostly we covered all. So if you have any question, please DM us, your name and phone
Definitely.
number. So
Yes.
one-on-one, you can get one counseling from our team. So whatever questions you have A to Z, it is free counseling for you, whether you join academically or not, but at least आप information तो आप ले लो at least, क्या 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 चीजें होती हैं, क्या क्या चीजें होती हैं, this
Definitely.
is good
Yes.
for you.
Yes. So guys, Academically Australia is the Instagram page where you should DM, and you'll get the response as soon as it is possible for the team, and they'll try to help you in all the ways, starting from the free information and the free mock test, which is available on their website.
Basically, academically provide courses not just for dentists. We provide for medical doctor, MBBS doctor, dentist, pharmacist, nurse, optometrist, physiotherapist, veterinary doctor. So any healthcare degree holder looking to migrate to Australia, US, UK, Canada. So we provide all these courses. So please visit academically.com, and also you can read. There's a lot of blogs we have mentioned on our website. तो हमने वहाँ बताया हुआ है, आपको बहुत सारे क्वेश्चन आपको वहीं पे खत्म हो जाएंगे. But still, if you want to get in touch with us, you can DM us. Then we can connect you individually.
Sir, there is one question regarding the specialist dentists, like those who have done their MDS here and now they want to move to Australia. So the process remains same for you. You have to go through ADC exam, right?
तो जो PG है ना, वो इंडिया का बेसिकली अप्रूव नहीं किया ऑस्ट्रेलिया ने, तो वो उसको नहीं मानते हैं. बट इन जनरल अगर आपको अच्छा एक्सपीरियंस है, फॉर एग्जांपल आपको 8-10 साल का एक्सपीरियंस है आफ्टर यू डिड योर PG MDS के बाद में, if you have 8 to 10 years experience and we are very good your CV, extraordinary, all those things, then you can apply as a specialist pathway there. Otherwise you need to go to this ADC pathway only.
Right. And after becoming dentist in Australia, you can do specialization. Seats are very much limited, but definitely scope is there. If you want to excel there, definitely you can do that.
Yes. Anytime you can.
Yes. So if you guys have any questions, any doubts regarding the cost or anything, definitely you can drop a DM to academically.australia, or you can directly DM to sir as well, Dr. Akram Ahmed.australia. Right. So yeah, it was a very informative session. Sir, thank you so much for sharing this information with us.
Thank you so much. Thank you guys.
Yes. Bye everyone.